I am the way I am because somewhere along the line it was repeatedly demanded of me. You will fulfill your obligations to these people. You will be worthy of them coming to you and saying, help me. Because those patients come into me the same way they came into my granddad in the 1920s, which is, hey, doc, I'm sick, fix me. No matter what you do, just fix me. That's all that matters. But our return has to be, I'm going to do everything anybody ever can to fix you. And if you're not willing to do that, then give it up. Do something else. Do something else.
Michelle Ellis, 32 years old, was diagnosed with cervical cancer 2 years ago. Since then, this mother of 4 has had radiation, surgery, and chemotherapy to try to keep the disease at bay.
I've seen a lot of doctors, they treat you like a patient, but Dr. Montz, he remembers, things about you more personable, I guess. Like when you go into the operating room, he holds your hand, and for me, that makes me trust him more. Hello.
What's going on?
I'm still waiting.
I know.
Dr. Montz suspects Michelle Ellis's cancer may have returned, but first, he wants to see a fresh CT scan.
One of my big fears when I chose to be an oncologist was that when I would get older, I would become cynical and detached, which I think a lot of people do as a defense mechanism. It's pretty likely this is due to your cancer.
All right.
But, when we've got the CT scan results and when your pain's a little better control, I'll go over with you and I'll tell you kind of what that means and where we go.
Okay.
And I haven't had it happen. I have the exact opposite. That it is easier for me to become attached. And I think maybe it is because the older I get, the more personal interactions and personal emotions matter to me.
Yeah, get that done.
You got a nice room.
Yeah. I like it. Yeah, right. I bet. Yeah, I bet.
I'll see you bright and early in the morning.
Okay.
And then we'll get your...
I'll be grouchy then.
That's okay. I won't wake you up.
Okay,
I'll
good.
come in. Okay.
Okay.
We'll get your pain under control.
Thank you.
Yeah. That everything else really pretty much starts to fall away. And it's, having a wife that loves you and kids that love you and a dog that'll sit on your lap and good friends and patients that care about you and patients you care about are really pretty meritorious. It's great. Oh, yeah.
Dr. Montz has just received the latest CT scan for Michelle Ellis.
She's had more than just a little progressive disease. It's pretty remarkable progressive disease. And this is sort of stuff that, again, chemotherapy is not really going to be able to help her much. And so she's really pretty quickly coming to the end of the road. And so our issues now have to do with what does she want to do with the rest of the time she has, and what are we going to do to make what time she has left as livable as possible. But controlling the pain doesn't relieve the suffering of a young woman who's going to die and leave her kids and the world that she cares about. Hi, young lady. How are you? You feeling better? How's your pain doing? A lot better? I got the results of your CT scans, and I want to talk to you about them. The findings aren't very good, and it's grown a fair amount. You can now see it's kind of sitting here.
Yeah.
So it's pretty significantly bigger. But Michelle, what we got to talk about is what this means. And it's not good what it means. What it means is, despite all the things that you've had done, and despite the fact that you've had the chemotherapy, that the stuff's growing. And as I've talked about before, that every time we use a treatment or we treat you, and it doesn't work, it's much less likely something else is going to work. And that's kind of where we're getting. And I think you need to look at what you want to do. You have a limited time. And I can't tell you how much that time is. I really can't. Long ago and far away when I was really young and thought I was really hot, I would guess. And I was wrong so many times. I think that one of the wonderful things about dealing with human beings is that at times there's role reversals. And when I had to tell her what she subliminally already knew, and I knew I had to tell her, she realized that it was hard for her to hear it, but it was hard for me to tell her. And she did something which is really pretty spectacular, which is she told me that it was okay that all the effort that she and I put together, I mean, this massive surgery, the hours in the OR, the recovery, the problems, etc., that all that was okay. It's hard to have done all you've done and gone through all you've gone through. You can give everything you have to an individual and not have accomplished what you wanted to accomplish. And that young person who could have been a woman that you went out with, or, you know, your best friend's wife, or your sister, kind of can look at you and say, you know, it's okay. It's okay. Thoughts? Questions?
After that, I mean, I already knew.
Yeah.
So, I've already been dealing with it. In a way again. So, no, not really. Not much.
Sorry, baby.
Well, we tried.
I know.
So,
Sorry. I'll talk to you in the morning.
yeah. Thank you.
You're welcome.